Hi, everyone, and welcome to our Wound Care Micro-Session series. I am Sarah Holtman, Director of Clinical Education with Wound Care University. In these short sessions, 10 minutes or less, we'll tackle one high-impact topic at a time so you can take a practical pearl back to the bedside. Today's topic is calciphylaxis, a patient-centered overview. I will explain calciphylaxis in plain language, what it is, why it happens, how we recognize it, and which treatments help. The goal is to help you understand options and partner with your care team. Everything here is drawn from our patient guide and the studies summarized there. Calciphylaxis is a condition where calcium is not handled properly in the body. Calcium can deposit inside tiny blood vessels. Those deposits block blood flow to the skin and the fat under the skin. When tissue loses blood supply, it becomes very painful and can die. That is why red areas can quickly turn dark or black and form ulcers. Many patients with calciphylaxis are on dialysis for chronic kidney disease, but it can also occur in people with milder kidney problems and even in people without kidney disease. A subset of cases is related to the blood thinner warfarin. If you take warfarin, your provider will coordinate with the clinician who prescribed it. For people with mechanical heart valves, there is a way to treat calciphylaxis while keeping warfarin if it is truly required. If you do not have a mechanical valve, we usually stop warfarin and switch to a non-warfarin option, but only after your provider discusses risks and alternatives with the prescriber. Diagnosis is typically clinical, based on how the lesions look and behave, and on your overall risk profile. A single skin biopsy finds calciphylaxis only about half the time. That is why having an experienced specialist evaluate you is important. Lesions often start as a very painful red area that rapidly darkens. Ulcers may appear anywhere on the body because the problem is blocked blood flow. The wounds do not heal normally and remain painful without targeted treatment. The most serious risk is not just the wounds, but overall survival. Without effective treatment, about 7 out of 10 people with calciphylaxis may die within a year. With the right therapy and wound care, that risk can be reduced substantially according to the data summarized in our guide. For many years, intravenous sodium thiosulfate was used, sometimes right after dialysis. However, the best available research summarized in our guide shows it does not improve survival or wound healing. For that reason, we do not rely on sodium thiosulfate as primary therapy. A key change came in 2019 when researchers reported that vitamin K, specifically K2, can be an effective therapy. K2 supports the body's handling of calcium in a way that addresses the underlying problem that drives vessel calcification. In our practice, we use vitamin K2 as first line therapy paired with expert wound care and risk factor management. We recommend vitamin K2 at 600 micrograms daily. Over the counter brands vary, so check the capsule strength. You may need more than one capsule to reach 600 micrograms. Bring your K2 to the next visit so we can confirm the dose together. Most patients feel less pain within 1 to 2 weeks. With comprehensive wound care, ulcers usually improve within about 12 weeks. Because calciphylaxis can recur, we recommend continuing K2 long term to protect against new lesions and internal complications. Vitamin K2 is an over the counter supplement taken by many healthy people and is considered safe for long term use. Vitamin K1 has stronger effects on clotting, and that is not the form we use. If you are on anticoagulation or have complex conditions, do not change medications without talking with your care team. Success comes from a team approach. Align anticoagulation decisions with cardiology and nephrology, begin vitamin K2, and pair it with meticulous wound care, pain control, and nutrition. We will track progress and adjust as you heal. Thank you for attending this wound care micro session. I am Sarah Holtman. We value your commitment to patient care. We'll be back with another focused topic soon. See you next time.